Colon cancer rarely announces itself with pain in the beginning. Instead, it often shows up as quiet, easy-to-miss changes that many people brush off as normal or temporary. And while colon cancer remains most common in older adults, the fastest increase is now happening in people ages 20 to 50. This shift isn't because our genetics suddenly transformed overnight. It's because modern lifestyle patterns and gut health have changed dramatically within a single generation. Here's the encouraging part. Your body can send early warning signals long before a serious stage develops if you know what signs to pay attention to and if you take them seriously. Hello, health champions. In today's video, we're going to walk through 10 early signs of colon cancer you should never ignore. 1. Anemia. And you might wonder, what does anemia have to do with colon cancer? Anemia means your blood is not carrying oxygen as well as it should. In simple terms, you don't have enough healthy red blood cells to deliver oxygen throughout the body. Here we're talking specifically about iron deficiency anemia. That's the type that happens when your iron stores are being depleted, so your body can't keep producing red blood cells at the pace it needs. When your red blood cells drop, your oxygen carrying capacity drops right along with it. When anemia is connected to colon cancer, the link is often slow, ongoing bleeding. This kind of bleeding can occur anywhere along the gastrointestinal tract. If the bleeding is higher up in the digestive system, such as the stomach or the duodenum in the upper GI tract, it tends to be a faster blood loss. Faster bleeding is usually more noticeable, and it often causes very clear symptoms. The blood also changes as it travels through the digestive tract. It starts out red, but as it breaks down and mixes with digestive contents, it darkens and can turn black. That's how you can end up with what doctors call a black Terry stool. But bleeding from the colon is often different. It's usually slower, smaller, and easier to miss. Many times it becomes what's called occult blood loss, meaning hidden blood loss. You may not see bright red blood, and the stool may not change color in an obvious way. The bleeding can be so small that it's only detectable under a microscope or with testing. Because of that, someone could have a tiny bleed happening over a long period of time, even for years, without realizing it. Meanwhile, the iron continues to drain away little by little, and iron deficiency anemia can quietly develop. So, why would a colon tumor bleed in the first place? One reason is that cancerous tumors often create their own blood supply in order to grow. This process is called angiogenesis, where new blood vessels form around and within the tumor. The problem is that these newly formed vessels are often fragile and unstable. That means they can bleed with very little provocation, leading to slow, subtle recurring blood loss that's easy to overlook, but important to take seriously. 2. Persistent fatigue. Ongoing exhaustion can have many causes, and one common reason is exactly what we discussed in the first sign. If you're anemic, you have fewer red blood cells and less oxygen delivery, so your body has to work harder to do basic tasks, and you end up feeling drained. But anemia isn't the only connection. Fatigue can also come from inflammation, which is frequently associated with cancer. Tumors are living tissue. They come from your own cells, even though those cells have become abnormal and are behaving in harmful ways. Because they're active tissue, they have their own internal chemistry, and they release chemical messengers into the body. These messengers are often referred to as cytokines. Tumor-related cytokines can disrupt normal metabolism and interfere with the function of the mitochondria, the parts of your cells responsible for producing energy. When that cellular energy system is being disrupted, the result can be a deep, persistent fatigue that feels different from ordinary tiredness. The problem is that this kind of fatigue is often brushed off. Many people chalk it up to stress, a busy schedule, poor sleep, or simply getting older. But when fatigue is persistent, unexplained, and out of proportion to what you've been doing, it deserves attention rather than dismissal. 3. Subtle shift in color. Most often what people notice is stool that looks slightly darker than usual. The reason comes back to hidden bleeding, the occult blood we talked about earlier. When there's a small amount of blood that you can't clearly see, it may be coming from a location higher in the colon. If you're seeing bright red blood, that usually suggests the source is closer to the opening. But when bleeding happens farther up, the blood has more time to darken as it moves through the bowel before it reaches the end. The tricky part is that it may not look dramatic. The darkened blood can mix with normal stool, and instead of turning the stool obviously black, it may only make it a shade darker. For many people, that change is so subtle it's easy to miss, especially if you're not paying close attention. That's why testing can matter. A stool test can pick up what the naked eye can't, because it can detect occult blood even when there's no obvious red color and nothing clearly visible. Another important detail is that this type of bleeding may come and go. These tumors often form their own delicate network of blood vessels, and those vessels can be fragile, but they may not bleed every single day. If your bowel movements are soft and smooth, the area may not get irritated enough to bleed. Then when constipation hits and stools become harder or more abrasive, the tumor surface can be disturbed and bleeding can start again. So a darker stool that appears on and off, especially when combined with other signs, is something you don't want to ignore. 4 changes in your bowel habits. This happens because a tumor can disrupt the communication system that controls your gut. Your body has neurons in the brain, but many neurons also live throughout the digestive tract. That network is called the enteric nervous system, and it helps coordinate intestinal muscle contractions, local blood flow, enzyme release, and the overall rhythm of digestion. When a tumor develops, it can interfere with that system in several ways. It may physically press on surrounding tissue. It can trigger inflammation in the bowel wall. And because tumors are living tissue made from your own cells, they can also release chemical messengers that change the local environment. Any of these effects can alter peristalsis, the wave-like muscular movement that pushes contents through the intestines. Once peristalsis changes, bowel habits can shift. You might notice stools moving too quickly, too slowly, or unpredictably. Inflammation can also change how the colon handles water. The colon normally absorbs water back into the body, but inflammation can disturb that balance. If more water stays in the intestines, stools may become looser and softer. If less water remains, stools can become drier and harder. So, the pattern may swing in either direction, depending on how the inflammation and signaling are affecting the bowel at that time. This is why a new persistent change in bowel habits deserves attention, especially when it's not explained by a clear short-term cause. It's not just a comfort issue. It can reflect a deeper disruption in how the colon is functioning. And this matters even more because colon cancer remains one of the most common cancers in both men and women, and the overall burden is still high. In the United States, figures often cited are around 150,000 new cases and roughly 50,000 deaths each year. But what's especially concerning is the trend in younger adults. In the age range of roughly 20 to 50, rates have been increasing the fastest, with multiple reports describing about a 1% to 2% yearly rise over recent decades in younger groups. The bigger picture is that your intestines are a delicate, highly regulated ecosystem, and worldwide, we're seeing shifts that can destabilize gut health. Many researchers have pointed to a decline in microbiome diversity, meaning fewer different species of beneficial bacteria living in the gut. Antibiotic exposure has increased. Processed foods have become more common across the globe. Physical activity has dropped, with more time spent sitting and less time moving outdoors. Screen time has risen, and chronic stress has become more widespread. At the same time, metabolic diseases and the inflammation that comes with them have increased dramatically. Together, these changes can reshape the gut environment in ways that may contribute to the rising trend we're seeing. And the key point is this: the numbers people quote from the United States are not an isolated event. Similar patterns and risk factor shifts are being discussed worldwide. 5 gas bloating, or that uncomfortable feeling of early satiety. Early satiety simply means you feel full sooner than you used to. You eat a small amount, yet your body sends the message that you're already done. When this happens alongside increased gas and bloating, one possible explanation is that something is partially blocking the normal flow through the intestines. As a tumor grows, it can begin to narrow the passageway inside the bowel, the lumen. Even a partial narrowing can interfere with how gas and intestinal contents move forward. Gas can get trapped behind that narrowed area, which increases pressure and can create the sensation of bloatings, cramping, or abdominal discomfort. When the pathway is no longer wide and clear, food and stool have to push past the obstruction. In a sense, the contents are forced to work their way around a bottleneck. That can slow transit time. And once transit slows, fermentation tends to increase. In other words, bacteria have more time to break down material in the gut, and that can lead to more gas production. Slower movement can also shift the bacterial balance in an unfavorable direction. The longer food sits, the more opportunity there is for gas-forming, more pathogenic species to gain ground. That can amplify the bloating and make the digestive tract feel increasingly backed up, even if you're still having bowel movements. And this is where early fullness fits in. If the digestive tract is struggling to move things along efficiently, even a small meal can create a sensation of congestion and pressure. Your body may respond by turning down appetite and signaling fullness early. Not because you've eaten enough, but because your system doesn't feel capable of comfortably handling more in that moment. 6. Tenesmus. Tenesmus is the feeling that you urgently need to have a bowel movement, often with discomfort or even pain, but little or nothing comes out. And even if you do pass a small amount, you're left with the persistent sensation that you didn't fully empty. Then, soon after, the urge returns again, as if you have to go right back. This can be an early clue for a tumor located in the lower part of the large intestine, especially in the rectum or the sigmoid colon. To understand why, it helps to picture the layout of the colon. The large intestine is divided into sections: the ascending colon, the transverse colon, the descending colon, and then the sigmoid colon, which curves down toward the exit. At the very end is the rectum. The sigmoid colon and rectum are especially important because they contain stretch receptors. These receptors are what normally sense pressure and stretching as stool collects, and they send the message to your brain that it's time to go to the bathroom. If something takes up space in that area, what's often called a space-occupying lesion, such as a tumor, it can trigger those stretch receptors even when there isn't much stool present. The tissue feels stretched, and your body interprets that stretching as an urgent need to evacuate. So, instead of stool causing the pressure signal, the tumor itself creates the sensation. That's why tenesmus can happen even when you don't truly need to go. And it's also why the feeling can persist after you've tried, because the source of the stretching isn't removed by a bowel movement. 7. Stool narrowing. This is when your bowel movements become consistently pencil thin. If it happens once in a while, that alone usually isn't alarming. A very soft stool can sometimes come out thinner than normal, and most people have seen that occasionally. The concern is when it becomes a pattern, when it's happening over and over again, and the stool is consistently narrow. The reason this can matter is that a growth inside the bowel can reduce the space available for stool to pass through. In other words, a space-occupying lesion can partially block the channel. When that happens, the stool may be forced to change shape just to squeeze past the narrowed area. If constipation becomes severe, the situation can worsen because harder stool may not be able to mold and pass through at all. In some cases, the body tries to compensate by drawing in or releasing more water to soften the stool because softer stool is easier to deform and slip through a tight passage. Many people who later receive a colon cancer diagnosis describe a similar pattern in hindsight. They report months of pencil-thin stool showing up before they ever noticed obvious pain or visible blood. 8. Dramatic shift in bowel habits. This goes beyond the mild changes we mentioned earlier and becomes more intense, more persistent, or more disruptive. One common reason is an obstruction that starts to interfere with normal stool movement. When a narrowing becomes significant, stool may struggle to pass, transit slows down, and constipation can develop. As the stool backs up, it can irritate the inner lining of the bowel. In response, the colon may attempt to protect itself and push things through by releasing more water into the intestine. That extra water softens the stool, making it easier to move past the narrowed area and helping the bowel flush the contents forward. Because of that cycle, a very typical pattern can appear alternating constipation and diarrhea. the constipation comes from the blockage and slowed transit. The diarrhea-like episodes occur when the bowel suddenly releases water to soften and evacuate what has been stuck. At the same time, it's important to keep context. This pattern is not unique to cancer. Many different conditions can create similar symptoms, which is why understanding the underlying mechanism matters. An alternating constipation and diarrhea pattern can be a hallmark sign of an obstructive lesion, but it can also show up in conditions that are less severe, such as IBS or IBD. Both of those should still be taken seriously and addressed properly, even though they are not the same as cancer. 9. Visible blood in the toilet or blood on the toilet paper when you wipe. When blood is clearly visible, it can sometimes suggest a more advanced situation, but it can also simply mean the source of bleeding is located very close to the exit. Location matters because blood changes color the longer it travels through the digestive tract. If bleeding happens near the anus, there isn't enough time for the blood to be digested, break down, or darken. It doesn't have time to coagulate and turn black. So it may appear red in the toilet bowl, and it can even look bright red if it has just been released. Another reason you might see red blood is if the bleeding is heavier. A faster, larger bleed can move through quickly and still appear red by the time you see it. To understand why tumors can bleed, it helps to remember what tumors are. They come from your own cells, but those cells have changed in harmful ways. Normal, healthy tissue is structured and organized. It has layers, boundaries, and predictable architecture. Cancer tissue loses that orderly structure. Because cancer cells grow in a more chaotic, disorganized way, the tissue they form is often more fragile. That lack of organization makes it easier for the surface to break down and bleed sometimes earlier and with less irritation than you would expect. As a tumor grows over time, it often becomes even more disordered, with more generations of abnormal cells and more distorted tissue architecture. Advanced tumors can be especially fragile. The more chaotic the structure becomes, the more likely it is to crack, tear, and bleed. In some cases, parts of the tumor can even slough off, shedding tissue as the disease progresses and spreads in directions it shouldn't. So, when a tumor is larger and more disorganized, it may bleed more easily and more often. That said, seeing blood in the toilet or on toilet paper doesn't automatically point to cancer on its own. In real life, this sign is very commonly mistaken for hemorrhoids, which are by far one of the most frequent and common explanations for visible red blood with wiping. 10. Weight loss. This is especially concerning when the weight loss is rapid and unexplained. In other words, you're not dieting, you're not fasting, you haven't suddenly increased your exercise, and there's no obvious reason for the change. There's no deliberate effort, yet the scale keeps dropping, and it's happening quickly. There are several ways this can occur. One major pathway is hormone disruption. Tumors are metabolically active tissue. They have their own chemistry, and they can release chemical signals that interfere with your body's normal signaling systems, including hormones that regulate appetite and metabolism. As those signals get distorted, appetite can fall sharply. You may feel like you're still eating normally, but in reality, you're eating much less because the drive to eat has been quietly suppressed. Another mechanism involves inflammation. Tumors can release inflammatory messengers, often called cytokines. These can push the body toward increased tissue breakdown. They can accelerate muscle loss while simultaneously reducing the body's ability to rebuild and synthesize new muscle tissue. So you're losing tissue faster than you can replace it. Those same signals can also drive a state sometimes described as hypermetabolism, where your basal metabolic rate rises. That means your body starts burning through energy at a higher rate even at rest, which can lead to the breakdown of both fat and muscle without you doing anything differently. On top of that, growing tumors consume nutrients aggressively. A defining feature of many tumors is that their growth is poorly regulated. They tend to expand as fast as they can, and as they get larger, they effectively divert more nutrients toward themselves. In a sense, they compete with your healthy tissues for fuel. And finally, there's the digestive side of the problem. When the gastrointestinal tract is disrupted, it may not digest and absorb nutrients as efficiently as it should. So even if you are trying to eat, you may not be breaking down food properly or absorbing what you need, which further accelerates weight loss and weakness over time. When all of those processes are happening together, it's usually a very concerning signal. It's often a serious late-stage warning sign. In many cases, it's referred to as cachexia, an advanced syndrome where multiple systems are breaking down at the same time. People can experience profound loss of strength and quality of life, and the body enters a state of ongoing decline that can be very difficult to reverse once it reaches that stage. If you found this video helpful, you're going to love the next one. And if you truly want to understand health by learning how the body actually works, make sure you subscribe, tap the bell, and turn on all notifications so you never miss another potentially life-saving video.